Hi, I'm Dr. Greg Relo. I'm here to talk to you a little bit about tooth extractions. Tooth extractions or removals are a pretty standard procedure in dentistry, often done by a general dentist or an oral surgeon. It's usually done to remove a tooth that isn't in very good shape. So one that's been damaged from gum disease, trauma, or a very large cavity and maybe is abscessed, and it's time for that tooth to be removed. In some cases, a tooth may be removed that's actually in pretty good shape. Why would you do that? For example, in orthodontics, if you have extremely crowded teeth and you need to make room to get everything else into alignment, there are times where you may remove one, two, three, or four specific teeth, usually on the sides, to help make space. Now, you also may remove wisdom teeth. So wisdom teeth are often removed in teens, and millions of them are taken out every single year. So there are many different reasons why teeth can be removed, but usually the tooth is compromised in some way. So there are simple tooth extractions, which from a dentist's perspective are fairly straightforward, and the tooth can be moved and elevated and taken out of the mouth. In some cases, there are surgical type extractions. These are teeth that maybe are broken off or have very long roots, and there are some things that need to be done to get that tooth out. Wisdom teeth are also usually surgically removed in many cases, and that's because they're either sideways or crooked or buried underneath the gums and in the jawbone. And so there needs to be some exposure of the gum and the bone in order to get to that tooth and to remove it. And so if you're going to have a tooth extraction done, it's usually done after an exam. Your dentist determines that it's time for that tooth to be removed, and an x-ray is taken and to determine the size of the tooth, the presence of other structures like nerves and so forth. And then we'll always look at the medical history, make sure that everything seems stable, that you'll handle a minor surgical procedure just fine. And one of the main things we look at is if you're taking any blood thinners, because obviously there's going to be some bleeding, and we want to make sure that everything will clot up and heal just fine. We may also consider antibiotics and see if you're on antibiotics or if you should be on antibiotics, depending on infection and risk of infection. And if you have diabetes or other heart conditions that we need to know about, there are a number of factors that we always want to consider when we're looking at taking out a tooth. So when a tooth is removed, we numb it very, very well. There should be no pain during tooth removal. Now, there is a strange sensation of having pressure applied in and around a tooth, but the tooth should not hurt. And with today's dental anesthetics, that should be pretty well guaranteed. Now, you can also have sedation in some cases, depending on how you feel about the procedure. You could have a light sedation, like with nitrous oxide or laughing gas, or there's certain medications you can take, like Valium if it's indicated. And in some cases, you can be put completely to sleep. That's often done with more challenging wisdom tooth removals. But it's always an option that you can talk about with your dentist or your oral surgeon. So once it's determined that the tooth should come out and the appointment is scheduled or done at the same time as the exam, you will be numbed very, very well. And then a series of small instruments are used to loosen the tooth and to remove it. And again, there can be some strange sensations of pressure in and around the tooth, but there should not be any pain with that particular procedure. So after a tooth is removed, there are just some things that you should be aware of. Obviously, there can be some bleeding, and the first order of business is to get a really good blood clot formed in that area, because that's the first step of healing. And so we'll generally have you bite down on some gauze. Pressure is always a friend to in stopping bleeding. And so a little bit of biting pressure on gauze for anywhere from 30 to 60 minutes is usually adequate. We'll tell you to be careful with your diet in the first 24 hours, especially avoid anything that's really hot, because that can soften a clot and make it come out or start the bleeding again. And avoid really abrasive foods. So soft diet, lots of hydration, make sure you get your liquids and so forth. That's important. You want to be a little bit careful in the area of brushing and flossing. You should brush and floss, but just when you get into the area of the extraction, be very careful in that area for a few days. And so if you do some of those things initially and get the healing started, you generally do quite well. Now, there are some complications with tooth extraction. For example, you can get an infection in a tooth site. It is a wound in the mouth, and there are many, many bacteria in the mouth, up to 700 different types. And if the wrong mix gets down in there, or the area has been previously infected with an abscess tooth, there's the potential that you could get an infection there. It's not highly likely, but it can happen. You can also get what's called a dry socket. And a dry socket is where that blood clot that we talked about that's so important that it forms, if it doesn't form, or if it's displaced or dissolves, then you get exposed bone. An exposed bone in an area of a tooth extraction can be very, very uncomfortable. And we don't always know why a dry socket occurs. It could be that the clot just doesn't form properly. Maybe you didn't compress it long enough, or you had something very hot and it dissolved the clot. But a large majority of dry sockets occur in smokers. So you want to try to avoid smoking prior to the extraction and after the extraction as well, because that can increase the risk. You usually know if you have a dry socket if it hurts, especially like a couple, 3 days after the extraction. And if you start getting like a foul taste and a foul odor, that can be an indication that you have a dry socket. And if you go in and see your dentist, they can usually do something to help significantly with the discomfort. There's some special dressings that can be applied to the area. So be sure to see your dentist or your oral surgeon if you think you have a dry socket. And absolutely, if you have any swelling, especially more than 24 hours after, if it starts to increase, or you run a fever, anything like that, you definitely want to follow up. A tooth extraction is relatively inexpensive compared to some of the procedures in dentistry. You always want to consider the cost of the x-ray and the exam prior, and that can, run anywhere from $30 to $75 for an x-ray. Could be more, like up to $125 or more if it's going to be wisdom teeth and we need a very large x-ray of all areas. But the extraction itself is likely to run somewhere between $150 to $250 if it's a simple extraction. If it's more of a surgical extraction like we talked about, it could be $250 to $350. And if there's complex wisdom teeth involved, maybe $300 to $500. But if they're simple wisdom teeth, they could be less than that as well. And then if you want some type of sedation, depending on the type of sedation, there could be costs associated with that. If you have dental insurance, any type of dental benefits, there's usually pretty good coverage with most plans for at least a percentage of the procedure. So you'll want to ask your dental office about that and see if you can get an estimate on the cost before you have the treatment done. So if you feel like you may need a dental extraction, or you're dealing with any kind of discomfort or swelling at all, it should be evaluated no matter what the treatment is. But you can feel free to reach out to us. We have a trusted network of dentists and specialists for every kind of need in every area, and we can help you get connected with someone that can take very good care of you. So I hope that helps if you're preparing for an extraction or considering one. And feel free to reach out to us so that we can help you get connected the best way possible. Please take care.